Welcome to Cosmic Edutech by Dr. Priyanka, your trusted space for smart biology learning, exam tricks, and the latest in the life sciences. If you are a NEET aspirant, BSc, MSc student, or simply curious about science, you are in the right place. Today, we are diving into one of the most futuristic and exciting topics in modern biology. That's 3D organs. Imagine printing a heart or a liver or even skin, just like printing a document. Sounds like science fiction, right? But it's real and it's happening now. Imagine a world where patients don't have to wait for years for an organ transplant, where scientists can print a heart, kidney, or even skin just like printing a 3D model. Welcome to the fascinating world of 3D organs. What are 3D organs? 3D organs are artificial organs created using 3D bioprinting technology. Instead of plastic or metal, these printers use bioink made of the living cells. The goal is to build a functional transplantable organ. The question is, how are 3D organs made? There are certain steps that are followed here. Collect the patient's cells, so normally stem cells or the specialized cells, mix them with the hydrogel and the bioink, feed the bioink into a 3D bioprinter. Printer deposits the cells layer by layer and the cell grows into tissues in the organs inside a bioreactor. Here are some of the examples. Scientists have already created prototypes of skin graft for burn patients, mini hearts and liver tissues for drug testing, 3D printed ears. Scientists have already created prototypes of skin grafts for burn patients, mini hearts and liver tissues for drug testing, 3D printed ears using patients' cartilage cells, and kidney models for research. In India, research groups are already experimenting with bioprinted skin and cartilage, bringing futuristic science to our own labs. This team from IIT Madras has developed India's first indigenous 3D bioprinter to make the process affordable and accessible for the Indian hospitals. Skin grafts. CSIR labs in India are testing 3D printed skin for burn victims. Then cartilage and bone implants. IIT Hyderabad researchers have developed 3D printed scaffolds for bone repairs. India is not far behind. Startups like Pandaram Technologies in Bangalore have already created 3D printed human liver tissues which are being used for drug discovery and toxicity testing. Then, why is this a game changer? No need to wait for years for the donors. Organs made from patients' own cells, so no chance of immune rejection. Faster, cheaper clinical trials using organ models saves lives in accidents, burns, and organ failure. In a country like India, where lakhs of patients wait for an organ transplant and donor numbers are low, 3D printing could be a lifesaver. But we are not yet there. Challenges include printing large complex organs like heart or kidney with full blood vessels, keeping cells alive and functional, expensive technology, and ethical concerns. In the near future, we might see hospitals with organ printing centers need a liver just printed. Burn injuries, print skin patches instantly. Imagine AIMS Delhi or some of the leading hospitals in India having their own organ printing labs. A heart patient could walk in and get a custom printed heart grown in their A heart patient could walk in and get a custom printed heart grown with their own cells. India's low cost innovation ecosystem makes this future possible sooner than we think. Treating organs are no longer a science fiction. They are the future of medicine. Very soon, a printer might save your life. Do you think this science Do you think this future is exciting or scary? Tell me in the comments. Do you think this is Do you think this future is exciting or scary? Tell me in the comments and don't forget to subscribe to Cosmic Edutech for more fascinating science stories.